Perfect. So good morning, everyone, and thank you for joining me. For those who doesn't know me yet, my name is Nava Getahun. I'm the head of Israel's trade mission to South Africa. The Economic and Trade Mission is a professional department at the Ministry of Economy and Industry within the Israeli Embassy in South Africa, and our main objective is to promote, facilitate trade investments and economic ties between Israel and South Africa by introducing them with the Israeli innovation ecosystem and providing them with the most accurate and current information on Israel's bilateral relations with South Africa. So if you have any questions on that, please don't hesitate to reach out to us, and we're more than happy to assist and provide you with all the relevant information. I want to thank our partners at the Israeli Export Institute, Karin Kidron-Mo and Alberto Spicciano, for supporting us in planning and coordinating this event. Last but not least, obviously, is Charmaine Hirshowitz, who's managing the life science sector in our office and who worked tirelessly to make this event a success. So thank you, everyone, and I hope that you find this event meaningful and insightful, and enjoy. Thank you.
I'll just give a few words of background to the topic. So I'm Charmaine Hirshowitz, Business Development Director of Agritech and Life Science. I want to welcome you all today, ladies and gentlemen, and esteemed guests, to our Medismart Breakfast Club number 4. Today we're here to explore a critical issue that has been exacerbated by COVID, mental health pandemic. Particularly in South Africa, more anxiety and depression and stress is on the rise. We see alarming numbers of 30% of the population that will experience some sort of mental health episode or disorder. The suicide rate is staggering at 23.5 per 100,000 people. Now, particularly affected are our youth. They're vulnerable due to socioeconomic conditions, etc. And 1 in 4 adolescents experience depression. Yet only 75% of those in need receive adequate care. Do not receive adequate care. Sorry. Now, mental health is a disorder or an illness that affects all of us, indirectly or directly. No one's immune. Turn to your left, turn to your right, whether it be your partner, your work colleagues. And today we're here to learn and gather insights from our STEAM panel, as well as our digital therapeutic companies, to address this burden of care, educate the importance of destigmatizing mental health, and explore how Israel is innovating solutions to this pressing global challenge. Without further ado, I'll hand over to Gila Taleb, Executive Director of ICAR, Israel Center for Resilience. He's a well-known speaker, partner at McKinsey. He has a passion for healthcare and an excellent speaker. Gila, over to you, and I'll allow you to address the rest of the panel and introduce them as you go along.
Sounds great. Thanks a lot, Charmaine, and thanks a lot as well to you, Nava, for organizing this great event. If you can give me the right to share my screen, I actually would love to share a few pages about this topic. Just very briefly, my name is Gila Taleb. I've been a consultant for 20 years, and as fate or luck or whatever you want to call it would have it, I left my position as a partner at McKinsey in July 2023 with the famous last words that I will know what I'll do after the Jewish holidays, after the Chagim of 2023. And as you all know, the world changed for us on October 2023. For the first few months after the war started, I was interim director of a center that was set up at Chavat Ronit. It is a wedding hall that was turned into a welcome center for the survivors of the Nova festivals and all the festivals in Reim. And then created ICA Collective to focus on mental health, looking at mental health at a population health level. And I could tell you more later on about it. But given this focus, I have been really thinking a lot about mental health and the role of technology in mental health. And so wanted to share with you a few ideas before we get into the discussion. One, I want to start by saying that the Israeli healthcare system is actually one of the most efficient globally. People in Israel will all be surprised when I say that, because we like to complain about our own system, but it is actually a system where you could see on the top here, we have a pretty long life expectancy at birth, and our health expenditure as a percentage of GDP is one of the lowest. And so we are actually a very efficient system, along with, Singapore and Korea. By the way, that little dot at the bottom left is the United States, that we know spends a lot of money, but doesn't get to a very high life expectancy. Why is it such an efficient system? A few things that we sometimes take for granted. One is that we have a universal healthcare system, meaning everyone has access to care, regardless of their background, origins, where they live. We have a regulated competition between 4 health plans. It means people could choose who's going to be their healthcare provider in terms of their insurance health plan. And there is a healthy competition that makes them want to compete for the most, I would say, healthy individuals. And then number 3, because of this, there's an alignment and an integration of incentives between payers, providers, government, to try to provide the best care at the lowest cost. And number 4, which is very important for this discussion, is the fact that we have a system that's digitally enabled and data-driven for many, many years. And a demonstrated ability to innovate and partner between government, private sector, startups, and hospitals. Now, I do want to point out that this is very true for physical health, not always for mental health. And given this discussion about mental health, it's important to say that the data aspect is not that easy in this field. I do also want to talk about, some of the issues that we have in Israel, especially when it comes to mental health. And for some of them, they're global issues. So they will also talk to those of you in South Africa. One, we do have workforce shortages, which is true almost everywhere in the world, but we have a chronic shortage, especially in mental health, attributed to low salaries, long working hours. In Israel, we have 50% less psychiatrists than what is the OECD average. Basically, if you want to get one number to remember, we have only 1,000 psychiatrists. That means they all know each other, really. They can fit into one conference room. And 40% of them are actually retiring in the next 5 years.
Gila, we won't do that because we don't speak with each other.
Okay. So you won't fit into one conference room. We'll need 4 or 5. You can all get into your own cliques. That's good. We get into the issues right away. Then we have some shortages of hospital beds and high occupancy rates, which you all know we're all moving to care at home anyways. People are really looking to innovate into having people stay at home. And one thing I want to say as well on the high occupancy rate, especially because this is a mental health discussion, is that there are estimates that 1/3 of people in mental health hospitals in Israel do not really need to be there. But they're there because we don't want that many people homeless. And when people don't have family at home that can take care of them, we have a tendency in Israel to keep them in the hospital, which is not the case in other countries. Equity and accessibility, as in many, many countries, we have disparities between central and peripheral regions. But also we have something that's particular in Israel is that we have a lot of culturally different groups. And so it's hard to always provide culturally adapted care. And that's one thing that technology can help with as well. The last 2 points are specific to mental health. One, there's still a big stigma in mental health. I don't think we're the only ones, but 1 in 3 Jewish Israelis say that they would deny themselves mental health support because of embarrassment and shame and negative social labeling. So that's something we really need to work on. And we have a complex and fragmented system because over the years, unfortunately, mental health has been perceived as a cost center. And you know that when something is costly, you tend to outsource it. So mental health was outsourced to family members for a long time, and then to NGOs and nonprofit organizations. And so we have hundreds and hundreds of nonprofit organizations that are being used as suppliers to the government to provide mental health services in Israel. So this is just to give you a quick, view on how the system works. And then I want to introduce a short framework on how to think about innovation in the field of mental health. I specifically decided to think about trauma healing, given where we are right now in Israel, but this applies to many fields. One, we have primary prevention as something that you do before any events. Sometimes we call it resilience. A lot of people are asking, what is the difference between resilience, mental health? There's a lot of language questions. Then after there was a traumatic event, we talk about secondary prevention, which we also speak about early intervention. Then there's the holy grail of treatment. And then tertiary prevention, which is rehabilitation and making sure people don't go back into the treatment system. And we talk about 3 levels of interventions. You can do things at the national level, you can do things at the community level, and you can do things at the individual level. And so it's important to think about these words when we talk about technology, innovation, to always ask yourself, is this something that's happening as early intervention or as treatment? Because sometimes people say, oh, you were treating people from the Nova, and I say, no, we were not treating anyone at Chavatronit, for example, for the Nova, we were doing early intervention, secondary prevention. If people have a diagnosis and need treatment, they need professional support. So a few ideas, and we'll get into this about where tech is needed. And you can see on the top, we have our pathway, and on the left, you have some of those ideas of national, community, and individual. And at the bottom, enablers, so things that we need to make the system work. A couple of examples that came up, I'll talk here on the community level, peer-to-peer support that can help people and also enable mental health professionals to focus on treatment. On the individual level, you're going to see in technology a lot of self-care tools that people can work on for well-being and to prevent mental health issues. On the treatment side and, between secondary prevention and treatment, you have some tools that are helping with triage and screening. You have new methods and technologies for secondary prevention and treatment. And then as enablers, we need to think about our caregivers, our mental health professionals that are suffering from, secondary trauma and burnout. And we need to think about data sharing and generating insights by really bringing together all of these data that I mentioned was very, very fragmented. And so, now we'll talk about some of the innovation that's happening in Israel and that can help also push the thinking in South Africa. I am happy to, introduce Dr. Mark Weiser and Dr. Oren Tene. Dr. Mark Weiser is from ShebaMedical Center, Tel HaShomer, and Dr. Oren Tene from Tel Aviv Medical Center at Ichilov. And I will first start by asking each of them to introduce themselves and maybe tell us very briefly, why they decided to focus on this field of psychiatry and mental health. Dr. Weiser, if you want to start.
Sure. Good morning, Mark Weiser from Sheba. Thanks for inviting me to talk about technology and mental health. It's something that I'm very, very happy and proud to be involved in. My involvement is because it's what we need to do. We have a tremendous lack, as you mentioned, we have a tremendous lack of mental health professionals in Israel. By the way, this is not just a problem of Israel. The lack of mental health professionals is something that's all over the world. The United States also, the psychiatrists are getting old and retiring. There are not enough younger psychiatrists. So this is a major issue globally, certainly in the Western world, and I would imagine in South Africa as well. So it's just what needs to be. It's really what needs to be done. Also, I probably should not say this, but I will anyway. I do a lot of research into trying to understand what causes mental illness and studying new medications. And our progress has been quite limited in many respects. So we're doing the best we can with whatever tools we can to improve mental health care. We're doing our best to try to develop new medications and new treatment modalities, but using all sorts of digital things is certainly another way of pushing forward on this. So I don't know if that's enough of an intro, but I'll give you some examples. Go ahead, Oren.
You're on mute, Oren.
Yeah, I've seen that now. So that's technology for you. It helps you in one arm, but then you have to tackle it in the other. It has to work for you. I think it's a good example, the mute stuff. And also yesterday I was doing like we were in a very big WhatsApp call, not a Zoom call, and it kept falling down, and it kept we kept not hearing anybody. Technology has to work and work for us and not us for it. Maybe that's like something, a conclusion of this topic. But my name is Oren Tene. I head the psychiatric division at the Ichilovhospital Tel Aviv Medical Center, and I'm involved, as Mark said. I think psychiatry chose us. It's not something you choose. It's something you just it chooses you. I don't know why it chose me. I'm not special in any way, but once the choice was made, I really feel that this is a calling, and technology-wise, I'm very invested in this aspect because of exactly what I'm emphasizing, what Mark said, that we have the shortage of personnel, but also we have many people who do not have access to mental health in South Africa, maybe even more, and many people who aren't aware and don't want to receive any mental help. And I think these are extremely important areas where technology can aid us in scalability and accessibility. So thanks for having me.
That's great. So maybe let's start with this aspect of, for you, how do you see technology, digital and analytics impacting the field? What are you most excited about? And we keep talking about Israel post-October 7, but even before October 7, a lot was happening. So maybe you can speak a bit about what you're most excited about. Mark, you want to start?
Yeah, I have a whole bunch of things that I'm excited about, and I'll start with what we're actually doing here in Sheba. We're working together with Microsoft and KPMG to develop an application that can actually do a psychiatric interview. In other words, and one of the problems that we've discussed is the lack of clinicians, and what we're we're developing this program to do is to take a good psychiatric history, and it's based on an artificial intelligence, and it uses voice to text and text to voice technology. So actually the computer talks to the patient, and then the patient responds, the computer listens, processes it, and then asks the next question in a way very similar to what Oren and I do when we examine a patient. And we've moved on with this. We've been working on this now for more than a year. The first part of this project was done with actors. We taught actors to have depression, anxiety, mania, or PTSD, and then we had them interviewed by the program, by the application, and were then immediately afterwards examined by a board-certified psychiatrist. And then we compared the diagnosis that the program came up, the application made, with the diagnosis that the clinician made, and we had a 94% agreement. So very, very encouraging, and definitely helped us be optimistic and to move on with this. So we're now working on doing the same thing, but with real patients who are obviously more complex the real world is much more complex than just an actor being taught, etc. That was the first step, but we're now moving into the second step. So we're very excited about this. We've written this up, we've submitted it to a journal for publication. So that's the thing that I'm certainly most excited about.
And is the idea to go all the way to clinical decision making around diagnosis and triage, or is the idea to provide just the first step and then go to a psychiatrist, a human psychiatrist?
Well, either to a human psychiatrist, or either to a psychiatrist, or even more practically, to a GP. Or a nurse practitioner. I don't know if in South Africa you have nurse practitioners, but they certainly exist in the United States. But there are GPs, general practitioners in South Africa who are well trained. The medical schools in South Africa are actually quite good, but they're not psychiatrists. So that if you have a patient who now comes to you and he has this psychiatric assessment, which is printed out, and it's a full psychiatric report with differential diagnosis and recommendations for treatment, and the doctor can then see the patient, but has this pretty in-depth and well done psychiatric assessment, then this can give him more confidence to actually administer treatment and not just have the patient wait for to see a psychiatrist. At least in Israel, it can take months if you need to see a psychiatrist before you can actually get an appointment. I would not be surprised if in South Africa it would be a similar situation. So right now we're developing this as a decision. I think it's decision support system. I think that's the correct term. I'm learning all sorts of new terms.
Yeah. No, it's important because it changes your regulatory pathways. And for people who are listening to us and are looking into technology in the space, that's why I was asking, because you could do a clinical support tool like what you're mentioning, and then some folks are trying to go all the way into decision making, and that is more complicated on the regulatory side. So good to keep in mind, until what point are you trying to replace the physicians?
I mean, at some point we might, yes, try to go there, but right now I think we should be modest and take things one step at a time.
Amazing. Thank you so much for sharing that, Mark. And I'd love to go back to ask you a bit later about, what was most challenging in this whole process? What can we learn from your experience? Oren, what are you most excited about?
I'll tell you a story. I start that we opened a mental health clinic called a SIF for treatment of trauma and trauma-related disorders, because it's important to keep in mind that not everybody affected by trauma will present with PTSD. Many will present with other diagnoses that have been, worsened by the trauma. But when we opened it, we had a big conference with Sderot. We wanted to make it something from, Sderot is the city that maybe symbolizes most Israeli villages and towns that are very adjacent to Gaza and were infiltrated by terrorists on the October 7th war. So we wanted part of this conference to have a technological arm, and that we did in a hackathon we had in Ichilov in our hospital with gaming companies. Now, how did we decide to go to gaming? So I'll tell you a short story. My son of 12 years old is a very smart boy, really is. I'm not exaggerating, and not because he's my son, because he's smart. And he likes, like many kids his age, he's a lot on his phone and on the computer, kids this generation. Anyways, I was starting to somehow receive these awkward bills, like in my visa, like $29.90, that's like maybe $8, $10, again and again and again. And this came up to quite a sum. And I noticed this after this came up to like $1,000. And I asked my partner, what is this? Have you been like, what is this investment? And it turns out that Louis, my 12-year-old son, was buying something in his gaming application. And he bought it again and again and again. And it you know, he paid a lot of money that I didn't get back, by the way. So I went to my son and I told him, Louis, you are, and that's why I started by saying that he's smart. You're a smart kid. You knew I would find this out. You knew this would not go unnoticed. How come you did this? And he said, Dad, I know, but I couldn't resist the temptation. And that's the power of gaming. And that's when we did the hackathon, I said, let's go to gaming companies because we see so many patients that need to do tough things during their therapy, exposure therapy. Many aspects of therapy are really hard, even picking up the phone and going to your first and asking for your first appointment. And I sat in front of 6 leading gaming companies in Israel, technology, and I told them, please harness the enthusiasm and temptations from the field of gaming into something to do with therapy. Let's sit together and build something together. At the end of the day, they actually introduced in the hackathon on the pitch 6 beautiful ideas. I'm sure we're not inventing maybe anything new or just developing things that other people maybe also have thought about, but beautiful games that can be added to therapy. And we decided to go on with 2 or maybe 3 of these companies, 2 clinical trials in post-traumatic patients in Ichilov. So I'm very excited about this.
That's great. Thanks for sharing. And sorry to hear about how much money your son has spent on on games. I think all parents can share that experience. Charmaine, did you have your hand up?
Sorry, no, I was just trying to field a question, find out where it was coming from. Sorry,
Oh,
no,
great. No worries. I see another hand up from Mark. Mark,
Randall.
Yeah.
No,
No, Mark Randall.
Ah.
There he is.
Okay.
Can you hear or see me?
Yeah, we can hear you.
Good morning to you all. It's Mark Randall from South Africa. Sorry, I missed if there were any introductions of who all the panel are and where they're coming from. Did I miss that part?
Yes, you did, but we can quickly summarize. So I'm Gila. In background, I'm a consultant, and now I'm the executive director of a nonprofit organization called Ikar Collective that's looking at mental health in Israel from a population health perspective. Dr. Mark Weiser is a psychiatrist and leads psychiatry, at Tel HaShomer, which is a ShebaMedical center. And Oren Tene leads the psychiatry at the Tel Aviv Medical Center, which is also known as Ichilov.
Great. May I introduce myself?
Sure, why not? Go for it, Mark.
Okay. As I said, Mark Randall. I am the Senior Executive of Primary Healthcare Consulting and Advisory, doing primary healthcare level clinics. And I'm also the National President of the Old Age Home Association in South Africa, representing all old age home and retirement centers with elder persons and geriatrics. Why this particular meeting is important for me is the incidence of mental problems and illnesses within the older persons area, specifically dementia, Alzheimer's type area. So we have looked at some of the technologies used in this since COVID and during COVID. So this is of particular interest. So I was just trying to position where this meeting and the focus was so I can understand where I could fit in or be of assistance. Thank you. Thanks,
Mark. So this is a good question, and in general, and I'll ask Mark and Oren to add on. I think about technology in 2 different spaces when it's about mental health diagnosis and then neurodegeneration. neurodegenerative diseases. But Mark and Oren would love to hear your thoughts about how you think about the two.
About technology for neurodegenerative diseases, Alzheimer's, etc.
That's right.
Oh, there's lots of things that are being developed. Lots of things that are being developed. Yeah. So, first of all, the program that I talked about can certainly be relevant. Also, it can do a mini mental exam just as well as I can. But there's lots of other high-tech stuff going on in old age homes. One of them, for example, a friend of mine is developing using you can have I don't think it's laser beams, but it's some sort of photoelectric beams that can actually see if somebody falls, and if there's a change of that, or if somebody's not breathing well. And you can track all these things technologically in old age homes. You can do this, by the way, at home as well. And you can have fall detectors and things like that. There are even there's low tech stuff, where you have older people can have a button that they can press if they're stuck and they need help, as can often happen. There are other technological things going on with people forgetting to take their medicine, so they'll have an electronic box that that gives a signal if the patient.
Pill dispensers.
For pill dispensers. Regarding old age home, there's probably other stuff that is done just more broadly. Something that happens in Israel that is important. Regarding the technology, the computers, and not of all the systems, but in some of the systems, do talk with each other, so that if I'm seeing an elderly patient in my emergency room, I can actually log on and look at it's not his complete medical file from his GP, but I can see his diagnoses and the diagnoses and the meds that he's getting, which is often very relevant for older people.
Sorry, I didn't mean to disturb the agenda. I just wanted to introduce where the aspect of my side was. So please forgive me. Continue with your agenda, but I would appreciate at a point if we could have a little bit of a discussion if there is time in the agenda. Thank you.
Of course. No, for sure. And there are a lot of technologies. What I meant to say on the mental health and brain health perspective is just, in my mind, we have two different things, and even if you think about the drug delivery mechanisms and the research, the R&D that's happening in psychiatry, I think we see more in the neurology and neurodegenerative diseases than in mental health disorders, which is why in my mind there are two different aspects of research, but lots happening. And we'll keep that in mind, Mark, as we go along and talk about the evolving role of digital.
But if I may add maybe 2 sentences on this topic, then I think it's a very good, Mark. Thank you for bringing this up, because I think that many times when we talk about technology and about new inventions, and we think about young people automatically, that are more oriented maybe to these fields. But our main challenge, or not our main, but a big challenge, is how to help with these technologies older individuals who find it hard many times to even download an application. So then we have a double actually challenge here, to have the technology, but also to make it very friendly and easy to use, and there are many ways in which we can do this, and we're thinking about these aspects also, from pill dispensers, electronic ones that can also call your child if you didn't take your medication, so your child knows he has the alarm and he knows you didn't get them, but they can also ask you how you feel today and if you need anything, and that information can come into your GP maybe, and how you sleep, and how many times you got up during the day, and how many steps you made, things that are already, some of them integrated, but when we think about older individuals, especially with Alzheimer's, cognitive decline, dementia for many other reasons, we can, from diagnosis to medical follow-up, the opportunities technology offers are immense. And I think the future in this field is going to look very different than what we're doing today.
Yeah, I do work with the primary healthcare clinics, not only regarding frail care in that scope with geriatrics, but school clinics, where there's a lot of mental problems today more than ever before with the school area. I work with university clinics with students, where there's a lot of stress from university student levels. I work with the HIV clinics, where there are tremendous stresses for people that have been found to have HIV positive symptoms. The mining sector with the occupational health clinics, tremendous stresses that they face for many reasons. So I just wanted to paint the scope of the area in which I work, but I'm focused more on the geriatric at the moment, and henceforth this discussion. Once again, sorry to disturb your agenda.
No, and it's a good segue. So thank you, Oren, for that segue. Because I wanted to talk about the way technology can also help bridge the issues of access. And so you mentioned the access of different ages and different comfort levels with technology, but technology can also help with access on a geographic level, and also with quality of care. So would love to hear a bit of other examples maybe that you've come across that can help both Israel and South Africa when we think about access and quality.
Yeah, so I'm happy to take that one because it's another project that I'm very proud of, led by my good friend and colleague, Dr. Asaf Kaspi, who pre-COVID-19 came up with the understanding that technology can be used to help people stay out of psychiatric hospitals. And we have a project which has now been going on since 2019, pre-COVID, of online home hospitalization. So the patient needs to be hospitalized, and we have him here for one day inpatient, just to make sure that in fact he's not acutely psychotic, he's not suicidal, that he can be kept at home, and then we discharge him, with a tablet via which he is examined several times a day by a psychiatric nurse, is seen by the psychiatrist once every other day, psychologist, social work. Notice the patient gets the entire battery of bundle of psychiatric care that he would get if he were hospitalized, but at home. He has a smart watch which monitors what Oren was talking about, sleep and activity and things of this nature. And we actually treat the patient at home. This is not a replacement for all psychiatric hospitalizations in all cases, but it is relevant for some of the patients some of the time. And of course, patients are very pleased with this. There's very high rates of patient satisfaction because nobody likes to be in a psychiatric hospital, and it's much better and much nicer to be at home. And this is as efficacious as inpatient hospitalization. I mean, patients, they get their medication. We can email their prescription to the GP, so the patient can actually live many kilometers away from the hospital, but he'll get his script and then go to get his medication from the GP, and he gets complete wraparound psychiatric care at home online. It's and it works.
I can also tell you again another personal story. I'm sorry I keep it personal all the time, but it reminds me of stuff. Before COVID, like this was already, it feels like 10 years back, but I think it was probably 5-6 years back. An investor in high tech, who is a friend of mine, approached me, and he said, do you want to go into this initiative for telemedicine? It's gonna be probably very, very chic and suited after application. And I said, no, I don't believe in medicine from far away. And I
Yes.
then joined Talkspace as one of the investors. I could have been a millionaire because they were, so I'm very bad at investing. But fast forward a few years and the COVID begins, and I run here a clinic with like almost 100 therapists, and they close it. We have to, and we want to continue to work. And in a week, we telemedicined everything, and for many months during COVID, we did that. Surprisingly, when COVID ended, many people wanted to come back physically, but still, the ability for us to treat people who cannot physically come to the clinic, cannot maybe are very far away, or maybe physically disabled, maybe have other health issues that prevent them from coming here. This ability that we take for granted already is new. It's quite new. And we saw that when regulation and need and government and technology join forces, they can make a huge change in a week. This was, because before that, the HMOs, they didn't want to pay for this. They say it's not a meeting, and suddenly they're paying, and everybody, and we have the system of how we give them the prescriptions, and everything is working, and this can be done. And this is the power of systems coming together, of humans coming together, and as technology coming together with health. I think this is the potential.
Yeah. A couple of other things that are just might be of interest if we have time, just briefly. So, there are online digital therapeutics. So you can do CBT online for anxiety disorders, for OCD. This stuff is available in English. I mean, this in English, but also in Hebrew. There's a CBT program for insomnia. We have a program in our outpatient clinic where a patient who's being treated, not general internet, but a patient who's being treated can communicate with with the therapist, also have access to various applications, mindfulness, et cetera, can of course leave a message to the clinician if he needs help, immediate help, et cetera. So these are all technological things that are done that are helpful in making our work more efficacious, more efficient.
And if I may add to that also, that there is another aspect to this, that there is a lot of data online and a lot of opportunities, and we do need still regulation, and we need a lot of, we need to be careful, because people are now, we don't have, when professional organizations like Mark's bring something online, that's one thing. But when all kinds of unrecognized people who call themselves therapists, this is also, there are dangers also in this world. It's not just a rosy street ahead.
So I do want to touch on this. I'd love for both of you to share some of the, I would say some of the things we can learn from, some of the things that were complicated, difficult, obstacles. And I'm thinking, about those regulatory challenges to make sure that, those things are safe, effective. We also know, sometimes I get reach out from CEOs of startups, and when I ask them, what is the data that you have, they tell me, a paper from 1987 that shows that, it will work. And I was like, and it's always, funny, because we all know that, papers are one thing, but making sure that there's user engagement, making sure the application work in the real world is not the same thing at all. And so we learn a lot from user engagement. And so we'd love to hear a bit your stories and your insights from what got on the way and the obstacles that we can learn from for those who are going through this journey in South Africa.
Would you please let me know when we get to item 3 of the agenda? Thank you.
Yeah, Nava and Charmaine will send you a message. Mark, Oren, any thoughts?
Yeah, I'm thinking about the challenges. So, I mean, I can tell you, for example, in developing this, first of all, it's in developing the program, the application that I told you about first, we call it LIVE, L-I-V, and the reason it's called LIVE is that's the name of the daughter of the woman who's leading this project, Iris Stein, her daughter's name is LIVE. But, I mean, you know, working with artificial intelligence and you know, getting into the guts of this is not simple, and how to have the computer answer the question correctly and base it on a commonly used clinical skills. That's certainly a major technological challenge. Other challenges are relevant actually also to, I think, Oren actually referred to this, older people who are less technologically inclined, and they might have difficulty downloading an app. They might have difficulty using their smartphone. And also, Oren was completely right. This is a common experience to all of us, that after Corona, when everything was all being done online, people actually want to come in, and there's an age difference there. The older patients and the older therapists prefer people coming in the face-to-face meeting. Younger patients and younger therapists are fine on doing things online. You know, they can have long, very personal chats on WhatsApp without even talking to each other, or do things on a video WhatsApp call, etc., etc. So that's certainly another challenge. Oren,
You know, Mark, when you mentioned this, it makes me think of I had a chat with a colleague of mine, and he said he asked his teenage daughter, "What are you doing tonight?" And she said, "I'm watching a movie with my friends." And he said, "Where are you going?" And she looked at him and she said, "No, we're using the Netflix app to watch a movie together." And it's such a different generation, right? Where they still feel they're watching a movie together when they're using the Netflix app, and when you pause, it pauses the movie for everybody, right? Like there's this togetherness, even though they're not together. And so definitely something we all need to think about in terms of different generations.
You remember the movie The Matrix, the movie where they harness the brains of people, and actually they use just the brains, and everything is a virtual experience. They're not really living in a real world. So we're getting there, you know. That COVID did this. We didn't come physically to work. We didn't touch physically people. Just our brains are used, and this is done already in technology in most jobs in the Western world. You don't work with your body, you work just with your brain. You just have to bring your brain in. I think, though, there are a few challenges from small to big in this field. Maybe a small one is how to have a Zoom application where the person doesn't look at himself talking, but looks at other people. Because once you have yourself on screen, I don't know it. So that's a small challenge, but maybe the bigger challenge is, and this is a challenge in technology, I think, not only in mental health, but how do we humanize? How do psychology is an art. It's not just a questionnaire. It's not just it's an art. There is you learn this, and the field is also, we're like a guild, because we tutor our residents, or we teach by showing them our work. It's not, you can't teach this just in academy. So the main biggest challenge is how to bring the art of being human and the physician into a technology. I think that's like in a sentence.
Great. We wanted to also open it up for questions from the audience. While we do this, Nava will help open up the questions. what is one thing, you were just talking about the brain, and we know our brain is unfortunately pretty limited, and so many things that are requiring our attention. If you wanted people to remember one thing from this webinar and from everything we talked about today, what would that be? What do you want people to live with? Oren, you want to start with this?
I would say that that really you have to dare to dream, because the sky here is the limit to what we can do. I think and maybe not fear progress as much as we do, because even as Mark was telling about the application they are making that can replace a doctor doing the intake, I was a bit frightened to hear this. I said, what about us? What are we gonna do? So we have to understand that technology can help us, cannot lead the way, but can help us in leading the way towards the areas we wanna reach. And I think that if we dare, if we're not afraid, and if we dream big, we can do many big things.
Yeah. And it's funny you see this, because somebody was saying, will AI replace all of us? And I heard a very smart answer, which was AI will not replace all of us, but AI people who use AI will replace the people who don't use AI, right? And it's really about thinking about sometimes we're worried, oh my God, is it going to replace me? No, but if you don't adopt it, then likely you will be left behind, right? So
I tell people who are afraid of this that AI, the toughest mission for AI is to be human. So think about this, that AI is trying to mimic us. So it's okay as long as it's mimicking us and not we mimic it. That's where we have to stand, I think.
Mark, what do you want people to remember? One thing that you want them to take away?
It's further to what Oren's saying, and that is the need to be flexible. The understanding that, yes, I'm used to, if I need to see a doctor, I need to come in to see a doctor. This is not necessarily only for mental health. We're working on a very large AI project in our ER, in our emergency room, a general medical emergency room. So yes, you have a medical problem, you have to go see a doctor, and the doctor will give you a prescription, and you go do that. But there are different ways to deal with this. And being flexible is an important thing in life, and it's actually it's quite a rare commodity. And many of us, we like things done in our set way, and you've got to be able to realize there's different ways to go about these things. This might be perhaps relevant for consumers, for patients, and for those of us who are interested in actually developing this field, etc. I just echo Oren saying, allow yourself to dream and to think about where you'd like to be, and then try to find a good solution to that, because there's things that are still happening and can happen.
That's great. And just adding to what you both said, I would say, one thing that came up with both of you is this idea that, will it replace me, or, where will my patient go? And there's this concept of scarcity versus abundance mindset, right? And sometimes I speak to mental health organizations, and they're still in this scarcity mindset. They think they're competing with one another, and if a patient goes somewhere else, then it doesn't come to them. And I say, unfortunately, with the aging population, with more and more issues of mental health, we're in an abundance situation where there's enough work for everybody. And whenever we will get new technologies and new organizations to take on some of the patients and some of the needs, there'll be enough for everybody. So we need to think about this abundance mindset that doesn't limit us. And that's where you get to dream about what's possible, and in a way that's limited. I would love to open it to, we have a couple of minutes if there's anyone from the audience that has a question.
I think we're running out of time, Gila. So I'll take this opportunity to thank each and every one of you, Oren, Mark, and you, Gila, for moderating this Super interesting panel discussion. I'm expecting that we'll have many questions that we'll send out to our emails soon. So thank you again. And I'm sure that all of our participants learned so much about the industry in Israel and how the psychiatrists and the mental health departments are working in those hospitals. So thank you again so much.
Thank you so much for having us, and really we would love, I think, follow-ups. Mark and I love to meet each other every time. I have to run, so I'm sorry, I'm leaving.
Thank you all, and
All
thank you,
right.
Mark.
Bye-bye.
Bye-bye. Okay, to Charmaine, you're on mute.
Technology. Next, we're going to present you with Aviv Kushner from Wellplay, our AI platform for mental health therapists and patients, enables the mental health institutions to shorten long waiting lists by providing their patients with immediate help through the digital platform. As Oren and Mark spoke about, it neither be one size fits all. It can be continued throughout the journey after discharge, etc. Correct me, Achi.
We also have Aviv, the CEO of the company. He's joining like literally in seconds, but Achi, I think you can start.
Absolutely. Thank you very much for this presentation. I will just share my screen so we can start. Okay. Sound on. Oh, for some reason, I'm not able to share sound.
You want to try first without the sound? Let's see how it goes.
Okay, we have a video we wanted to have with sound, but can you now see the actual presentation?
Yes.
Okay, I just have a small question. Okay, we'll see how we go with the sound. Hopefully we'll have the sound. If not, I could explain while it's running. So thank you very much, so much for this opportunity to be here this morning. Thank you for Nava and Alberto for bringing us to this really important topic and subject. My name is Achi Kushner. I am the co-founder and COO of Wellplay, together with Aviv. My name is Achi, but Aviv is my brother. So Aviv is a psychotherapy therapist and entrepreneur, and he also basically was the co-founder and the man behind this whole concept and initiative and product that is going to have so much impact. So Aviv is with me as well. And without further ado, I would be happy to start. So when we talk about Wellplay, our vision, what we see in front of our eyes, is creating a world where mental, emotional support is readily available and easily accessible to anyone at any time. We want to empower individuals to improve their own well-being. Your well-being is basically our mission. If we look at the leadership team, we have at Wellplay, it includes experts from extensive experience in mental health. I've mentioned Aviv, the man behind the vision. We also have Mayan Porat, who is a clinical psychologist and clinical advisor. We also have technology expert. Roy Golan is basically the CTO and behind the development of the app. And we also have in our advisory board figures such as Professor Hoda Kibi, one of the leading figures in psychodrama in the world, and also from the business side of VU, business development, we have Dr. Itamar Ofer, and Tanya Leaf, and we are really excited about a young dynamic team that is really passionate about this important cause. If we dive in a little bit to the problem that is in Israel, but it's actually really representing what is happening globally. If we dive in and zoom in into Israel, we're talking about a problem of 8 to 12 months of people who are on the waiting list to start psychotherapy, to start any type of therapy. This is what Aviv has been able to see firsthand as part of his involvement. We have severe shortage of emotional and mental health therapists, both public and private, and this is something that can be seen much further, and it's much more critical in developing countries. And we also see that the conditions are worsened as a result of the long wait. People that perhaps had not too severe conditions are deteriorating. And also we see as a result of that, there's also a premature termination of the therapy because of this shortage and this burden and stress that we need to treat more and more people that are on the waiting list. As I've mentioned, it's a global problem. In the US, it's even greater. We're talking about 80 million adults experience mental instability. Healthcare providers cannot help with the growing demand. And over there, we see average waiting time of more than a year. Waiting lists for psychotherapy have grown by 10 to 30%. And this is just showing that it's going to grow and increase. So we are looking at the solution that we have a digital platform for emotional support based on psychodrama methodology, enhanced by large language model. And it was interesting to see the panel before. Oren also mentioned, these new innovations are going to replace the actual therapists, but we really seeing it as a great opportunity for a holistic approach, a tool that will assist the therapist to reach a positive outcome faster. And also for those people who are waiting for so long, we will prevent their deterioration, and perhaps even we'll be able to prevent them from needing and seeking for support later on as a result of the deterioration. So the digital therapeutic intervention utilizes augment traditional emotional mental health care as a standalone intervention, and again, accessible to a diverse population and ages. If we just have a short look at where we've been, what we've been achieving so far, we started in 2022, one of the two major accelerators in Israel. Hakaveret is one of the biggest social impact accelerator in Israel, and the impact that we are creating is so important for us. And Sigma Labs, we also been part of an accelerator in the New York Yeshiva University in the US. We have won numerous awards from Israel, from the JDC, from two universities, leading universities, and also we are now starting a partnership with IBM. Our pilots, the main pilot that now we are running with our service is with one of the largest MGOs in Israel, Kupat Cholim, with more than 2.5 million patients. We are now in a project, in a pilot in Shalvata. It is one of the biggest mental institutions in Israel. And we're also looking, of course, to expand it further in Israel and outside. So for those of you who are not familiar about psychodrama, what is psychodrama is basically all about. So psychodrama, as you can see also in the image, is a clinically proven method that helps individuals explore their emotions and experiences through role-playing and group interaction. There are a lot of academic studies that have shown that psychodrama is effective in treating issues such as depression, anxiety, and addiction. And the uniqueness of the potential is in the ability to help the person who is now suffering to see and gain insight into their own behavior and patterns. And it's something that is happening in the here and now. For someone who actually had experienced that, it is really surprisingly and inspiringly how fairly quickly you are able to gain insights and relief and understanding. So if we take a look at the product itself and how it looks like, we have a five-step process that is designed step by step to walk through the challenges of the patients who are suffering at the moment. The first step is to focus on the issue of their concern. Why are they here? What are they feeling? The initial dialogue to the system. You can have here a look at the user interface, and it's a very fairly common questions and answers that you have. What is your fear at the moment? What are you now feeling uncomfortable with? And what are your main concerns? The next step will take us to the mental warm-up, where you actually start with attain more clarity and start really to share and associate writing what you feel in also an imagery method. Here we are going to be using the LLM, textual analysis and extraction of the main themes and leading emotions that you are feeling. The third step will take us to externalizing the conflict and constructing a scene representing parts of the conflict. And now this is a really important part, because this is where we can leverage on what is existing now in the digital world. The fact that you have video, audio, and you can actually combine these into what is psychodrama is all about, role-playing and understanding the here and now and being able to represent this conflict so you can gain really important and invaluable insight. After that, we have step number 4, processing the session and highlighting the awareness and analyzing in the insights and what you've gained out of it and being able to also record and preserve it. This is the part where you actually have insights and understanding of what has been going on. And this is the really important part. The first step, the last step, is basically additional references to techniques and articles and videos, things that we see in a lot of existing applications, where you're actually putting everything in proportion. You're able to see things in a positive way, and it's also directing you into material that will help the effect and the ease of relieving your current concern and challenge. This is just a little look at the product itself. I would be really happy to show you also to demonstrate a video that is showing how this is basically the access to the additional reference. But here let's have a look with the video that is giving you illustration of the third step. As I've mentioned, that's the heart and the core of the actual application and system, that you are able to construct a reference to what you are feeling. Can we hear? I hope that there is sound.
Dear Ben, please choose a character that can represent your mother in this conflict. Please select now.
The sound is here. Can anyone just let me know?
Yes, we can hear.
Oh, great.
Excellent. Now choose a character that can represent you. Ben, please select now.
Mom, I constantly feel criticism from you, like you don't forgive me for the past. It feels like you have a lot to say, but choose not to. Mom, I constantly feel criticism from you, like you don't forgive me for the past. It feels like you have a lot to say, but choose not to.
Now listen to what your mother wants to tell you. Please listen now.
You are my son, and I totally love you, but sometimes you remind me of your father, and it scares me, so I react.
In response to your mother's words, what would you like to say to her? Please record now.
Mom, I will never abandon you, never. I appreciate you and honor you. I'm not like father. I love you.
Dear Ben, now you can watch the full dialogue you created.
So this basically is giving you a small peek of how the third part, if you remember, the third step is illustrated. In this short demonstration, we've been able to visualize a conflict of the patient with his mother. But in another instance, this case could be also could be represented by a conflict of the patient with his inner self, his self-esteem, his anxiety, or what is the trigger of his depression. So of course it could be used in various ways. After, I hope you get a bit of a feeling of how actually this is done in real time, the digital platform, I will proceed to the market and the business model. So we are focusing on B2B. We're talking about sell subscriptions to different companies, HMOs. As I've mentioned before, we want this as a tool to help basically the therapist, and also to help those people who perhaps will not deteriorate or will need critically the therapist. The saving potential is 20 to 40%. When we're talking about saving, we're talking about savings that will be derived from the fact that now there will be reduced therapy hours. 20% members will need a shorter therapy because of the effectiveness of this tool. 10% of the members could pass the frontal therapy because they are at the initial stage that they need to elevate and improve and remove these aspects in the beginning step. So the business model is going to be B2B. In average, we're looking at $30 per patient for a subscription, and it will be focused on healthcare providers, insurance company, and so forth. As I've mentioned, this is something that we see when in front of our eyes is really the impact that we want to make, and to be able to have to do something also good in the world. And this is really aligned to the impact that we want to create and to the SDGs. When we're talking about having access to this application, first of all, we're talking about really reduced inequalities. Any person that will be suffering from any problem will be able to access this is in a way that is discreet, accessible, and overcome fears about starting. This is a lot of time. This is something that we can see, improving good health and well-being, and also by allowing people to have access to these facilities, we could see people that will have decent work and economic growth as a result of much better well-being and much better functioning in the day-to-day. Milestones, as I've mentioned, where we started with 2 leading accelerators in Israel back in 2022, we are now actually in the implementation in the pilot project in Shalvata Mental Health Institution. We are looking ahead at the development of version 1 of the system, and also, as I talked before, a collaboration with IBM, which could and would enhance the AI, the artificial intelligence features in this exciting application. And we're looking to expand our agreements with 3 more institutions in Israel, leading for 2026, where we're looking at developing version 2.0 of the system and entering the US market with first clinical trials there. So to summary, I want to say that the uniqueness of Wellplay basically is in the experience, how you can leverage the possibility that exists in the digital world and really match them. It's a perfect match to what is psychodrama is all about. Being able to create a personalized and unique animation environment for the user to actually gain benefits and improve his well-being. The high availability, discretion, as I've mentioned, and the ability to perform this anytime, anywhere is a huge advantage. And also the fact that this could be a tool that, imagine when you go to a therapist and after that you can do homework, you can continue to work in between the session and also be able to access what you've gained and the insights you've gained. So it's a tool that will also improve very much the efficiency of the actual traditional treatment that we have today. Doing all that, the patient will be able to use the mental capability and strengths that are inherent in him. So we are going to be very happy to also look into potential partnerships and collaborations, feel free to look us up on the internet, on LinkedIn, and this is our contact numbers. And again, thank you so much for the time and the opportunity to present here.
Thank you, Achi. Please stay with us because we have the Q&A session at the end. Charmaine, you're on mute.
Next, we're going to present Biagnosis, Yarden Katsir. Yarden, are you with us? There's Duff. I see Duff's joining us.
Yes, just Yarden.
Okay, hi everyone.
Hi,
Nice to
Yarden.
meet you.
You too.
I was not in the first session in the panel, I'm just going to start our presentation. Dr. Dror Epstein and myself, I'm Dr. Yarden Katsir. We created our venture almost 2 years ago. I'm a clinical psychologist. I have experience of 25 years as a clinical psychologist and as a diagnosticianist. Dr. Dror Epstein, he comes from the AI world, and he's developer in a Raphael company also. So I guess that like all the other companies, we are topping this subject of the shortage of therapists, but we believe in delivering the necessities, the solutions, and tailored solutions for people who are at need, for people who are at the waiting list and are not getting any treatment. Our app can also be as a duplicate and empowering tool within therapy. Our application, which is called Maxi, deliver 4 important elements. One is diagnosis, a very thorough diagnosis with a clinical interview. So in this part, we would want to know not only the critical symptoms, the severity, using questionnaires. We would want to know the person. We would want to know his resources. We would want to know his hobbies. We would want to know his style. And according to that, we deliver and tailor the second part. The second part is therapy, is tailored therapy using diagnosis, using AI, and it's constantly updating. So we create a very precise therapy program, choosing from dozens of techniques and constantly tailoring it to the patient's needs within the therapy. We actually believe, well, it's not replacing therapy, but it's giving this solution to person who don't get any therapy, whether it's the cost problem, whether it's the therapy being remote. We know that in South Africa, as well in the States, people are actually struggling to get to a therapist, and they don't live very, very near to the therapist. And also the embarrassment of going to a therapist. So it's an intermediate process that can connect the patient to the therapy. The third element is monitoring. We actually monitor the patient not only in terms of his resources and in terms of his symptoms, but also in terms of his functioning. We have a few measures, and we encourage the patient to occupy himself in a very large realm of functioning. And we believe in a very simple, but we think, very smart formula in which resources of the person, inner and outer resources, minus his stress, inner stress, outer stress, equals his level of functioning and his well-being. So actually, Maxi helped the person with dozens of techniques to focus on his resources and to regulate and to learn his stress, either inner stress or outer stress. So, for example, our PTSD model is right now being in a pilot with Leumit HMO in Israel and also the Sderot Center in Israel. And we are focusing in the PTSD prevention on tailoring the right solution according to their needs, according to the needs of the patient. And we also got the support of the Israeli Innovation Authority, and we have passed with flying colors the committee of the Ministry of Defense and Mafat, which recommended us to be part of the Israeli Coalition for Trauma. So our PTSD model is focusing on PTSD, but our anxiety model can be tailored to other anxiety disorders. Let me share our presentation. I don't know if you can see. Can you see?
Yes.
Okay. So we are giving a comprehensive solution through an application, diagnosis, monitoring, personalized self-treatment, and chat. This is the fourth element, chat with real live therapists, but it's very cost effective. The therapist within the chat is very crucial for the engagement of the patient to this program. And the therapist can give his umbrella of supervision over all of this program and the patient's progress. We have in our application an avatar which delivers the technique, which give you an assignment. For instance, if you're avoiding something, he builds with you together a scale from 1 to 10 and choose with you, the patient, the level that you want to begin, giving you the right tools which can be used to regulate the anxiety. So each week, the patient can go up in the ladder while remaining in the same level of anxiety as before. For instance, 10 will reduce to 9, 9 will reduce to 8, and so forth. So there is also the chat, there is also the pop-ups. Each day you have a pop-up. How are you doing? I'm feeling anxious. Okay, I'm here for you. And the chat continues. We're strongly believers in reinforcements for each progress. So Maxi will offer you to use a diary of resources and to fill it as much as you can with anything that can connect and reconnect you to your own resources. For instance, which is your best pal that you can tell him your most intimate secrets? Maxi will give you a little bit of an assignment. We'll ask you if you met him. Okay, we call this a friend for a beer. Maxi will give the a progress bar to the patient and to the therapist that's giving the chat. We think that our advantage, first of all, we are a knowledge-based startup. We think that we've managed to deliver all of the experience into very simple techniques. For instance, if you are not sleeping well, you'll get the avatar will give you imagery technique. If you have the stuck dream, the nightmare, the avatar will give you will build with you the dream in a positive way. So in order for you to, at the next day, to use this ending, this new ending, and for the dream work to keep on going without disturbances. Okay, I'm skipping our experience. Okay, so if I can demonstrate, actually there's a mirroring, but I'll try to do it like that. And just a second in English. Do you hear?
Relax your body and feel comfortable. Let's start.
Okay, so.
Are you ready to get to your safe?
Okay, so this was just for demonstration. So we have dozens and dozens of techniques, and which are all pretty much aligned with the specific needs of the patient, and we get constant feedback from the patient. Is there any questions that you would want to ask?
Yeah, then we'll keep the questions to the last part of this of the presentations. But in the meantime, I will thank you. And Charmaine, I think we'll move to the next company.
Yes, it's Asaf Shiloni from Xoltar.
Asaf is with us.
Yes,
He will share, he will share the screen in a second. So in the meantime, thank you so much, Erden. Please stay with us for the questions at the end of the presentations. Thank you.
Rejoined as a panelist.
Hi, Asaf. Thank you for joining us.
Hi, thank you very much. Yeah, so I'm just going to share.
Asaf, I finally got you to South Africa in some way.
Indeed, indeed.
Yeah.
For some reason, I cannot share sound. And I have a video.
You can. It's the same settings that were for your day in the previous presentations. Try and share the screen. It should work.
It's grayed out, but let's try. So it looks like it's not going to be with sound. We can just hope. In worst case, I'll narrate when needed. All right. So yes, so I'm Asaf Shiloni. I'm the CEO and co-founder of Xoltar. I'll tell you a bit about myself and the team before we dive in. So I'm coming from the worlds of computer science and psychology. Did my master thesis in AI and then joined the founding team of a very special company in sports tech, not in healthcare, not in mental health. We did this called Replay Technologies, a lot of computer vision, a lot of AI. We were acquired by Intel for $180 million. And then we were in the founding team. We spent some time in Intel, and then we left and took all of the brightest minds that we know from AI, added other bright minds from the worlds of man-machine interface and behavioral psychology, and added a whole advisory of healthcare experts to build an AI that can drive people to action and can help patients adopt hard habits and keep them for a long time, and pretty much accompany them in their journey. So each and every one of us will have to endure some kind of a journey in our lifetime. Unfortunately, it can be something quite mundane, like stopping smoking or weight loss program, or it can be something more serious, God forbid, cancer or any mental health issue. And what we see is that once we're there, we're not, as humans, we're not really good at this. There's a rule of thumb of, for example, 50% of chronic patients that can maintain their lifestyle or treatment that they're taking. Everyone gets hurt by this. Of course, the patients themselves, but also payers and pharmaceutical companies, in which we are mostly focused, not only, but mostly. When we look at non-adherence, for example, so people usually think of patients forgetting to take their meds, but this is much more complicated by this than this. This involves a lot of emotional status, involves all the different side effects that are related or not related to a treatment. There are many ways why someone would not take the treatment as prescribed, or not take it at all, or drop. I give just a short example from the oncology world. When patients are getting their chemo sessions, they go home, and then for a while they don't see anyone. There was a researcher named Dr. Ethan Bash, that found that if you only in a regular cadence, if you monitor them just for symptoms, for quality of life questionnaires, you can increase their chemo endurance by 30% and survival by 20%, which is pretty much amazing. Thing is that if they don't, they drop a treatment, and for no good reason. So what we do know is that if you are paired with someone with a shared purpose, who can develop a relationship with you, you are much more likely to endure whatever journey you have embarked on. And this is no news. So you have pharmaceutical companies with patient support programs, for example, and you have nurses, and you have in provider settings. And this is something that we know. If you throw enough accountability partners, those people who can communicate with you, who can give you, provide the emotional hand-holding, and this can be care management staff, it can be health coaches, it can be nurses, it can be anything, any accountability partner in the healthcare world, it actually works. So what I said about oncology is also true for a lot of other treatments, and we know this because when people try to stop smoking or try to lose weight, they go through these programs, and every time there's someone involved helping them go through it, they're much more likely to succeed. So it's a no-brainer. Pharmaceutical companies know this. That's why they invest a lot of money in patient support programs, helping patients adhere to treatments that are not cheap. But the problem is that you just don't have enough people. And this is something that you guys talked about it before. There's not enough staff. And when you have a lot of burnout, so you cannot throw more bodies at this problem, so to speak. What we do in Xoltar, we look at this relationship, the nurse-patient relationship, that we know that is working, and we are utilizing AI to emulate this relationship. So what we do, we take the evidence-based protocols that are being used today, and we utilize the most engaging form that we know of, which is the human-like interaction, and use modalities, multiple modalities, to reach these patients, in which we focus a lot on the video call modality. And this is for a kind of a trivial reason, but very potent, called social co-presence. So the more senses I have involved in an interaction, the easier it is for me to motivate the patient, and the harder for the patient to ignore me. And that helps us do all the things that can be done remotely, and are the things that are being done remotely today. This is collecting data, this is giving education, this is giving the emotional hand-holding, and helping them, motivating these patients. I'm going to show a quick example, just so we're going to be on the same page. This example specifically is on anxiety, so it's on the money. But as you can see, there's a lot more into it. Just let me know if you hear it. It's supposed to be music.
Unfortunately, no.
Yes, that's what I thought. We can try again if you think that the setting's going to be different. Do you want to see on your side if you can enable sound?
Yes, I'll make sure. Just make sure that also the volume in your side is on the highest level.
Mm-hmm. Yeah, now it's working. So just a second.
Hey, Ben, what's going on?
I've been trying to fall asleep for hours. Nothing seems to work.
That sounds very frustrating.
Yeah. And I feel like this medication's just not working. I just don't feel great, and it's making me feel stressed.
Let's think this through together. We will work it out. Don't worry. Remember, you told me the doctor said it takes at least 2 weeks for SSRIs to be fully effective. You just need to give it some time.
Yeah. 2 weeks.
Look, having trouble falling asleep might be a side effect of your medication. The good news is that we can change the time you take it, from the evening to morning time.
Really? You can do that?
Yes, it can make a difference. Let's call the doctor in the morning, and according to his recommendation, I could reschedule our check-in call to the morning. It's all going to be okay.
Sure.
Now, this is a great opportunity to practice the mindfulness skill you loaded last week. And if this won't work, I can download a very boring podcast you can listen to. You will be out in no time.
Thanks, buddy.
So there's as you can see, a lot of shiny technology, human-like companions that I can speak for hours about. But this is not the point, right? The point is to get to the place in which you can emit the same responses that patients give today for humans, for care management staff, but to these AI companions. And the studies that we conducted find exactly that. So first of all, patients are engaging in lengthy conversations with our companions. You can see that in a smoking cessation study that we've done, patients spoke for 14 minutes on average on a video call. This is not something that I used to do with my colleagues. But the system can also detect nonverbal communication. So we know that patients are smiling and they're shaking their heads and they're nodding. And we know when they are engaged in the conversation and when they are not. And they even hand wave at the end of the conversation. So they do, although they know that this is an AI, they do treat it as a human. And the more important thing is that they keep coming back. You can see here the 91% retention rate for in almost a month of chronic pain sessions. We also have in oncology, in ovarian cancer, patients who were almost 4 months, and the call response rate was around 75%. So this is something that's a lot of effort to invest in something which is not a human. But we also saw seen behavior change. We got smokers to quit, and we can dive into these kind of things later. What we do here is we know that this relationship works today, and this is the first stepping stone. So what we created is the AI companion that on one side, as you've seen in the video, interacts with the patients through a mobile app. But just the same, on the other side, there's a lot of analyzing of all the behaviors on the back end, and everything goes and digested towards the current staff. They have a dashboard. It empowers them. They can utilize these AI companions as co-pilots. So whatever journey they support, we can increase their effectivity and in a lot for not a lot of money. The way that we work is we find a domain expert who already have a program. They already have a playbook or any evidence-based protocols, anything they give their staff on their first day of work. And we do have our behavioral models, and together we have created a skill builder. Skills are replicas of protocols that are completely autonomous. And we do this in a zero-shot fashion, so we don't need any data from this domain expert. And once this is done, we have a skill, something that can start running, interacting with patients automatically, and bring back information to the supporting team. We are focused a lot of cancer, on cancer, but this is a general purpose system. So we also have eye care for retinal disease, and we're doing smoking and chronic pain and psoriatic arthritis. And of course, mental health is, it's a big cloud in here because, again, you can support any protocol out there. When I'm saying protocols, they could be CBT, it could be motivational interviewing, it could be anything that is currently working, non-physical. protocols that are currently working right now. Once this is in action, you have a companion which is already skilled with a specific mission. Behind the scene, so again, a lot of technology here. I will split it into 3 parts. There's a skill building part. I said zero shot. We don't train anything. We don't need our customers' data. We don't need the time or the money to do this. All we need is just static information. Think about anything that new care managers need on their first day of work. This makes us very fast. Within a few weeks, we can be up and running with a totally new skill. What we cracked here is during the real-time interaction, and it's called the free guided conversation. Free guided conversation meaning that one party, that's the AI companion, comes with an agenda stemming from the protocol. It's a set of goals. They know what they want to get into in the conversation, and at the same time, the patients themselves feel like this is a free conversation and they can speak about anything. And anytime they derail the conversation, which is every time, the companion knows how to gracefully bring them back so they can complete all the goals. And we have something like 98% goal completion. Because of the high social co-presence, because this is most of the interaction is a video chat. We do have text messages and news feed and stuff like that, but mostly it's those bi-weekly or weekly sessions. Because people can see themselves and because they can see a human-like character, they don't feel good hanging up. So they complete all the goals or most of the goals in a conversation. That's one part of it. Second part, because we are not using LLMs in the fashion of just like building a foundational model or prompt hacking a current model, we have something which is an AI agent infrastructure. The protocol itself is transparent, is traceable, reliable. So we don't need to go through the hard regulation of AI because we know where the conversation gonna go in each time, and we know eventually exactly what happened in each point. And because this is built like this, so the conversation feels like very free, but it's not exactly free. We can take the data across patients or across sessions for the same patient, and we can gather a lot of interesting insights. Some of them will help us personalize the experience for each patient because each patient is different. And some of them will help us improve and optimize the skill itself, making it better and better with time. The insights that are coming from this, from the system, we'll say the patient behavior insights, are very interesting, and those are something that are very compelling for the pharmaceutical companies we work with. Again, we're focusing mostly on pharma, working with Bayer and Novartis and multiple drugs. Again, on age-related macular degeneration with Bayer, and with Novartis on Cosentyx and psoriatic arthritis, but now also on breast cancer. This is something that we published 3 weeks ago, that we're starting with them and with Bellinson Hospital, Division Center. But again, we're doing with Mayo Clinic chronic pain, and we are open to do any program that can help and that is viable. Again, this is not a treatment. So if you look from the mental health perspective, we're not here to replace anyone during the treatment. We're giving the support. We're adding touch points throughout the treatment. We're not giving any medical advice, no diagnosis. We are the emotional hand-holding portion of it. So when you look from the mental health perspective, this is the way to boost the effectiveness of the current team on journeys that can be protocolized. At least the support part of them can be protocolized easily. This is a per member per month business model. So it really depends on the amount of patients themselves. And again, we're happy to talk with whoever is interested in these patient relationship solutions. Thank you.
Thank you, Asaf. We're going to take questions at the end, Nava, just confirming. Yes. Okay. We're going to move on now to Karen Golan from IDAN Health, who's got a unique avatar which encourages strong patient engagement. Karen.
Hello, everybody. Yeah. Hi. Hello, and thank you for having me today. I will quickly share my screen, if I may. And I promise to be brief. Okay. IDAN Health is an AI platform for patient care. The goal is to collect, monitor, and aggregate health data into actionable insights. We were founded in 2022, and we started working with 6 MVPs in Israel and in the US in the past 2 years. We have 3 current customers, and we are in the 4th version of the software. The goal in this particular idea is to create a new era of health for the patients, helping the doctors get there. So IDAN in Hebrew is an era, and we are in a verge of creating new era of using data for clinical trials and getting more information for the doctors to help the patients. We started with finding out that all medical research is basically non-existent because the data is not being saved. Just to give you an idea, 50 million clinical studies are running every year, and only 477,000 were published up until now. So we aim to get the data that are being used by clinical clinicians and clinical trials and hold all the information in one place to help the clinician get better ideas of how to treat. We basically created 3 versions desktop. On one hand, we have a centralized database that we can collect all medical and symptoms data. All sources of data are being collected in one place, so later on can be questioned. On the other side, we have the clinician side, which can run any type of clinical question that he wants for any type of clinic. It can be a real-world clinical trial or a study or a clinical trial that runs by a pharmaceutical company, and the data is being saved in one centralized place. And the 3rd version of the system is the patient's avatar. We'll talk in a minute of the actual avatar that we developed. The idea is the patient can hold all the information in his hand, use his own avatar to specify exactly what is the symptom that is bothering him, and everything is being logged into the system so everybody can use it later on. The team is very diverse. The 2 founders, Dimitri and myself, are coming from 10 years in clinical data, 14 years in entrepreneurship, and before that we held several positions in higher places in the industry. Our basic background is coming from imagery and development of clinical medical information, and with our advisory board who are coming from all kinds of medical expertise, we have a very diverse integration of how to look at clinical data in order to get basic insights that will give us later on much more things to do with it. This is the actual system. It's been tried out and is already working in several places in the world, one of which is the San Jose Mental Health Clinic in California. And the idea is that the physician can basically create his own medical question. The San Jose Clinic have 5 different clinical, medical, real-world clinical trials that are running at this time, and they are looking to get their patients better health, better quality of life in order for them to be a participant inside their medical journey of being better, getting better. On the other side, we created an actual 3D avatar, which is the patient's lookalike and the way that he can integrate his own feelings and own medical information into the system. Every avatar has its own lists of symptoms that are integrated into the human body parts. And if you want to say how you feel or give any kind of information of your whereabouts, you simply push the avatar and get a list of the specific symptoms in the same body part and give back a description of what do you feel. The goal is to get the communication inside the system. So once the clinician gave a task or a question to the patient is giving it back inside the system as well. We built the entire thing on the idea that the patient is the owner of the data and he can share any type of information that he wants with whomever he wants. That gives us a default HIPAA compliant, which brings us to the second tier, which is the security of the data. All the information is being diverted to 3 kinds of places. The personal information of the patient is being held in a specific different place, which is the same as the clinician protocol. And the centralized medical data is being held in a 3rd different place, which is to be shared with everybody and everybody can use it. So the next time someone is running a clinical study, he can use all the data that is already being used before and already being shared by other clinicians, other specific companies that are using the data to their own clinical trial. And this gave us the GDPR compliance as well. At the end of the day, the goal of the system is bringing access to more data, giving the physician a way to get their clinical study more efficient and shorten the time of the clinical study. And at the end of the day, save a lot of cost with running a long clinical trial. So once we have the entire thing inside one place, we can actually questionnaire the data. We can give the data a way to give us back all kinds of ideas. And through the case studies that we already did, we found several insights coming out of the data, one of which is the PTSD and how to slow down the development of it. The goal of the study was to find if there are any kind of protocols that are being processed or ongoing with patients who are suffering from same type of symptoms. And what the engine in the back found is that in several ways of treatment, we can slow down the symptoms that are being manufactured by the same patient ongoing, and it can be seen in other patients that are suffering from the same symptoms. We had several breakthroughs through the data, and one of which was already patented and published. And the goal is to get more and more information so we can get more and more insights that will help doctors give better treatment to their patients. Both sides of the IDAN system are giving access to patients and researchers to run all kinds of questionnaires on the data. Because we eliminating all the options to actually send a full questionnaire to the patient, we're getting much more compliance from the patient to give the researcher a way to work with the patient ongoing. IDAN is a task-oriented platform that gives all the facilitation for the researcher to work with any type of clinic that he needs and basically create any kind of medical research inside the system. We are here and we will be happy to work with any medical facility in the region. We already have dialogue with medical facilities in Kenya and England and Canada, and we're looking forward to talking to you as well. Thank you very much.
Thank you, Keren. I think at this time we'll open the stage for questions if anyone has. I see that Playwell are not with us, but I mean, if you have any questions, so feel free to ask them now. Otherwise, we are always available in our emails, and we can, with pleasure, connect you with Keren, Asaf, and Yarden. So in the meantime, I want to thank the three of you for really phenomenal presentations, and it was amazing just to see how technology can really assist patients and health givers in taking care of those problems. I think we tackled one of the most, I would say, complicated but also sensitive issues within healthcare. And I think mental health, when we're combining technology into that, definitely there is so much to learn and so much to see. And thank you for demonstrating that. So I don't see any questions coming, but I'm sure they will come later on from our experience. It's always coming within emails. So in the meantime, again, thank you so much. And thank you for everyone who joined us to this webinar. We're looking forward to see you in our next session. And thank you, Charmaine, for coordinating this event. And thank you, Alberto, from the Israeli Export Institute, for your support and for coordinating all the program together with Charmaine. So, Charmaine, there is something you would like to add?
Yeah, just to say that we are going to be sending a recording, and you'll be able to choose which companies you'd like to engage further with, and we'll facilitate the connection. So if you've missed something or have a question you didn't want to ask online, we'll help you there.
Okay. Thank you so much, and we'll see you next time.
Great. Have
Thank
a good
you.
day. Cheers.
Thanks.
Thank you.